In today's video, we're going to answer the question, is a Medicare supplement plan worth it? Hello there, my name is Patricia. I'm a registered nurse. However, I help my clients understand Medicare and navigate through Medicare every single day. Let's get right into today's question. Is a Medicare supplement plan worth it? Before we can answer that question, we need to kind of understand how Medicare works and how a supplement plan would even come into play. All right, so Medicare is health insurance for individuals turning 65 in the US. If you worked 10 years, 40 quarters in the US, you earn Medicare because you paid into Medicare. You could also get Medicare if you have enough working credits and you qualify for a qualifying disability, SSDI. After 24 months of being disabled, you will automatically get Medicare. You also can automatically get Medicare for certain disabilities such as end-stage renal disease and you're on dialysis. So let's get right into today's video. Is a supplement plan worth it? So we talked about Medicare for a bit. Let's continue on, okay? So this is Medicare, right? So this is your red, white, and blue Medicare card. As you can see, there's two parts to Medicare. You have Medicare Part A and you have Medicare Part B. Medicare Part A is your hospital insurance. It also covers home health, it covers skilled nursing home care, and it covers hospice as well. However, Medicare Part B is your medical insurance. So this is going to allow you to see your primary care doctors, your specialists, help you with lab tests, diagnostic procedures, x-ray imaging. Medicare Part B also helps with paying for medications taken inside of your doctor's office, such as the flu shot, pneumonia shot, chemotherapy. Medicare Part B help with ambulance rides and mental health. So Medicare Part B definitely help with a lot. Like I said, Medicare Part B is your medical insurance. Let's talk about the cost of Medicare for a bit, okay? So Medicare Part A is your hospital insurance. Like I said before, you earn Medicare. You was paying for Medicare taxes and such. So this makes Medicare Part A $0 per month, okay? Now, Medicare Part B, however, does come with a monthly premium, and usually for individuals in 2025, the Part B premium is $185 per month, okay? And you also have Medicare Part D, which is your prescription drug coverage, okay? So Part D will help you pay for the medications that you take that is prescribed by your doctor at home, okay? So we talked about the parts of Medicare. Now let's talk about the supplement, a Medicare supplement plan. Why do you even need a Medicare supplement plan? Well, we're gonna have to go back to original Medicare, right? Original Medicare only covers 80%, leaving you behind 20%. With that 20%, there's no cap, there's no ceiling, right? There's no max out of pocket, meaning that it's not like it's saying, well, once you reach $2,000, you stop. Once you reach $5,000, you stop. No, there is no max out of pocket. So that is a big deal, right? You have to come up with that 20% that Medicare leaves behind. You have to pay that 20% bill, and it's 20% of whatever. And that is a big deal. So this is why a Medicare supplement plan comes into play. It covers the 20% that Medicare leaves behind. So let's go a little bit further when it comes to a Medicare supplement. Like I said, it covers the 20% that Medicare leaves behind, giving you predictable coverage, meaning that you know what you're going to pay when it comes to your finances, right? It's better to be covered with a Medicare supplement plan with that 20% because then you know what is your predictable cost. So how does this actually work? So you have your original Medicare right here, right? You have your supplement plan right here. Medicare covers 80%. The supplement will cover the 20%. So they pretty much meet hand in hand like brother and sister, right? So original Medicare would cover the 80%. Medicare will let your supplement company to know that you had a Medicare related service and they need to pay that 20%. As long as it's a service that original Medicare provide, then the 20% will be covered by your Medicare supplement plan. You don't have to go through pre-authorization or anything like that. Like I said, long as a service covered by Medicare, your supplement would come along and pay that 20%. Now let's go a little further why individuals would take on a Medicare supplement plan. Now, let's talk about the premium when it comes to Medicare supplement plan. You will have to pay an additional premium for a Medicare supplement plan, okay? There are two types of major, or should I say popular, supplement plans. You have supplement plan G and you have supplement plan N, okay? So let's talk about the two. Both will require an annual deductible every year, meaning you would pay this annual deductible. Once your deductible is met, then the supplement will kick in and pay that 20%. For 2025, the annual deductible is $257 for the year. Say you go to the doctor in January and his bill is $150. You will pay that $150 till you meet that deductible of $257. Once you meet the deductible, the supplement will come along and pay the 20%. So that's really nice, okay? Another reason why individuals would get on a Medicare supplement plan is because they can travel within the US with a Medicare supplement plan. Meaning you can live 6 months in Florida, 6 months in New York, 6 months in Alaska, 6 months in Hawaii, and that Medicare supplement plan will follow you wherever you go within the 50 states in the US, which is really nice, okay? Let's talk about doctor networks. When it comes to a Medicare supplement plan, there really isn't a provider network. As long as your doctor takes original Medicare, then he will also take your Medicare supplement plan. Of course, he has to be accepting new patients as well. But it's really nice. So as long as your doctor takes original Medicare, that Medicare supplement plan will follow and pay that 20%. Okay, let's break down the differences between Plan G and Plan N, okay? So when it comes to Plan G, you would pay your monthly premium and Plan G would pay that 20%. So you don't have any copays whatsoever. You just have to pay your monthly premium. As long as you're paying your monthly premium, the supplement will follow and pay that 20%. Let's talk about a Medicare supplement Plan N. Works a little different. You still have that annual deductible just like Plan G. However, with the Medicare Supplement Plan N, you do have a few copays, up to $50 for an ER visit and up to $20 for a primary care or specialist care visit. So when you're seeing your doctors, up to $20 visit copay for those providers. Other than that, Plan N works the same as Plan G. It would pay that 20% that Medicare leaves behind. Of course, you do have those copays. Let's talk about when is the best time to enroll in a Medicare supplement plan. Okay, now some states are going to have different rules, so this is going to be generalized information. So the best time to enroll in a Medicare supplement plan is when you're first eligible for Medicare and you're turning 65. Why is that? In that first 6 months of enrolling in Medicare Part B, you don't have to go through any health questions, meaning you don't have to go through what is called medical underwriting, okay? So that means that if you have any type of chronic condition, you don't have to worry about that at all, okay? You would just go ahead and apply for that Medicare supplement plan. It won't ask you any health questions, and you could go ahead and enroll in a plan. So the best time to enroll in a supplement plan is within those 6 months. So what happened after those 6 months? You will be subject to medical underwriting, so you will have to answer some health questions. And unfortunately, if you say yes to any of these health questions, you will be denied, okay? That is the hard truth that we have to follow, but hey, you know now watching this video. So certain health conditions that may disqualify you can be conditions such as Parkinson's, diabetes with complications, certain chronic health conditions such as problems with your heart, AFib, congestive heart failure, COPD, HIV. So, yeah, these are going to be disqualifying questions to get on a Medicare supplement plan. So, I always tell my clients this when they first turning 65. Look at your health now and look at your family health, okay? That should help you determine if you want to get on a Medicare supplement plan. I know you don't have a crystal ball, but that is a guide that I like to help my clients navigate through. If you have family history of cancer or COPD or any of these chronic conditions, Parkinson's, dementia, and you want to get on a Medicare supplement plan, the best time is when you first turn 65 within those 6 months. Now, if you don't have any problems whatsoever, you're pretty healthy, then of course you could go ahead and enroll in a Medicare supplement plan after those 6 months and you will get approved. So that is really nice to know. But remember that underwriting is a thing. A lot of people get this confused because with Marketplace, you don't have to worry about pre-existing condition. However, when it comes to Medicare supplement plans, you do have to worry about pre-existing conditions, okay? So you want to look at your health, your family health, and your budget. Can you afford a Medicare supplement plan? And if the answer is yes to all of that, then I highly recommend a Medicare supplement plan. So the question today is a Medicare supplement plan worth it? And absolutely, a Medicare supplement plan is worth it. If you have any questions, leave them in the comment section below. Do you have a Medicare supplement plan? Do you have Plan G or do you have Plan N? Or are you thinking about a Medicare supplement plan today? I want to know. Let me know in the comment section below. If you have any other questions, let me know. I'd be more than happy to answer those. If you need any help when it comes to Medicare, give our office a call. We'd be more than happy to assist you. We never charge for our services, and we pride ourselves of giving great customer service. So give us a call. If you know a friend that need to hear this video, share this video with a friend. And if you're not subscribed to the channel and you want to see me again, subscribe to the channel. Thank you so much for watching, and I'll see you, yes, you, on the next video. Ciao for now. Bye.